The G8 leaders have been slammed for not providing enough help to HIV-positive people. Julio Montaner, the president of the International AIDS Society, claimed when it comes to global health, the purse is always empty. He made the statement at the ongoing AIDS conference in Vienna, which is calling for an end to treatment discrimination. Sarah Firth is there for us.
Does HIV really cause AIDS? Are the tests accurate? And are the AIDS drug treatments safe? Well, these are just some of the extremely controversial questions that are being asked by a group challenging the mainstream views on HIV and AIDS as the AIDS 2010 conference enters its second day here in Vienna.
And nobody could give me the paper where HIV is isolated in the way scientists were asking for it since the 70s. The other thing is that there doesn't exist any paper that shows if HIV is existing, how it is doing AIDS. And the special situation is that AIDS is a fully different thing in the Western countries, so-called Western countries, and the so-called developing countries in Africa and South America and so on. So it doesn't fit in a normal virus disease, because viruses only can make very few things.
Well, for the 25,000 people attending the official conference, these views have been met with extreme skepticism and criticism, and as we've seen, openly contradicted.
The virus has never been isolated. Well, that simply is not true. The virus has been isolated. It's been molecularly cloned using DNA cloning technologies. It's been sequenced literally thousands of times from different individuals infected with the virus. And so it simply isn't true to say it's never been isolated. Secondly, no one knows how the virus causes immunodeficiency is also not true. We know very well how HIV works.
The focus of the opening talks that we saw yesterday were very much focused on the theme of this year's conference, which is rights here, right now. So we heard them underlining the importance of a successful response to HIV will be resting on a successful response on an individual level. So we heard lots about the needs to address marginalisation and stigmatisation, especially among high-risk groups. Now Russia in particular was mentioned here for its prevalence of HIV in injecting drug users and the need for greater resources to be put into things such as needle exchange programs. So the debate will remain ongoing for this week, and it's not a new debate since AIDS came to the public attention in the 1980s. There were people who openly opposed the mainstream views, and as we can see, that continues. But for the people that are attending this official conference, the main focus really is on what they're saying are these life-saving treatments and making sure these reach the biggest number possible, and that funding is there from the governments of the different countries to provide this universal access to the HIV prevention treatments.